A few weeks ago, we did an episode on perineural therapy, and I had injections done in my neck because I had some neck pain that I had been struggling with for a few days. Well, my mom is in town, and she has been struggling with some knee pain. She'll tell us a little bit more about what she's been feeling, but I thought it would be good to show how versatile this treatment can be, and anyone who has had chronic pain or acute pain can get this treatment done. And Patrick will again explain a little bit more about it. So, we're at the clinic today and we are going to show what it's like to get perineural injections in the knee and the IT band. Here we go. Okay, I'm here with my mom, and she is going to tell us a little bit more about what her knee has felt like and what has got her excited to try this treatment. So tell us about your current symptoms.
My current symptoms right now is on the side of my knee, it actually feels like there's something inside tearing. So I can't put full weight on it. And at night, I can't lay on my side because it actually hurts my knee, like something is just in there pulling all the time.
Gosh,
and it hurts really bad.
That sounds so painful.
It is.
And how long have you been struggling with this?
I've actually had this for the last 2.5 to 3 years. And I've actually been to 2 different orthopedic surgeons to find out if it was part of my replacement knees that were getting faulty, but they couldn't figure it out. So they sent me to physical therapy, and I've been doing physical therapy for the last 6 months, and it has not worked at all. No change whatsoever.
Gosh. And what makes you excited to try this treatment?
What makes me excited is I want to be pain-free. I mean, it's to the point where normally I could be in a swimming pool and be able to swim without my knees hurting, but it's to the point where it actually hurts when I even kick a little bit. So walking is really hard for me. Stairs are literally impossible. I do the little granny one-step one up the stairs. So it takes me twice as long to get up those stairs. And I'm compensating my pain on my left knee, so I'm overusing my right knee, which is now starting to hurt on my right knee.
Oh gosh. Well, hopefully today this treatment will help. I know it's helped me multiple times in different areas, so we are excited to show the versatility.
We are excited.
Woo, woo, woo. We did it!
Okay, so we've covered perineural therapy before. It's a simple injection technique involving a 5% glucose solution. So it's minimally invasive and quite effective, and results are in 6 seconds. So we can usually find out right away how well it works. People often need the treatment repeated, so it's not always one and done. You may need 6 treatments, but you got to start with 1 anyways and see if it works and helps. Go from there. Both knees are bad. The left knee is worse.
Is the worst, but since I've been babying this one, now I'm starting to get it on this side. But
Okay.
It's just,
and you can point to it right
oh
there
yeah,
specifically.
it's like painful. When you push on it, it's painful.
Does it swell up right there?
Well, I don't know. I have fat knees, so I don't know.
Okay, not necessarily. Does it get red or warm or inflamed?
It gets warm.
Okay.
Mm-hmm.
And it sounds like you've been to back to the orthopedic surgeons and even to PT.
Yep.
They've worked on it a little bit.
Mm-hmm. And nothing works.
Nothing has helped.
No.
So that's makes you a good candidate for perineural therapy. Often when people have seen 2 or 3 doctors and tried other things, nothing works. It's often the nerves that,
Mm-hmm.
and we know with surgeries, joint replacements, that the nerves do get moved around and kind of irritated, and so they can get stuck and painful.
Mm-hmm.
So that's what this treatment treats, is the nerves that surround the joint.
Okay.
The nerves love glucose, it turns out. And so if you had to rate it like at a 10. I think you said it was pretty high, 10 being the highest pain.
Yeah. Like today, I would say a 7. Yesterday, we were at a 9.
Okay.
But I think that might have been from the weather.
Okay.
But yeah.
And it's been that high for how long?
The pain for over a year.
Okay.
It started gradually, but it just seems to be getting worse. It actually feels like there's something in there that's just like tearing.
Okay. And then is there like a squatting or stairs? Is
Oh,
there
I
anything that
cannot
makes
squat.
You
It
can't
hurts.
squat?
Oh no, it hurts. Stairs, I cannot put full weight on this leg.
Okay, let's have you do one mini squat. We just want to kind of gauge a little before and after.
Okay, so
just kind of.
see, that is very painful.
Starts
right
to
there.
hurt right there.
Mm-hmm.
Okay. And it hurts right there.
Oh yeah,
Okay.
it's right there.
Will you do that again? And then touch again.
Right there.
Any pain on the right when you squat?
This side, it just feels like it's pulling right here.
Pulling there.
Yeah.
Okay. The whole length of the nerve, the nerve that supplies this is called the lateral femoral cutaneous nerve. And so we kind of try to.
So how does the injection feel as you're getting it done?
It actually feels good. Like literally where my knee, when I normally bend, I can feel it. And there's relief,
That's great.
which is crazy. Because normally I have a hard time standing up.
Is it at least 30% better?
I would say it's like 70%
70.
better. I can't even feel it. That's crazy. I've never been able to do this because when I do this way, it just feels like it's tearing. So that's good.
Yeah, those, I think nerves were probably just stuck in there. So when you try to stretch it, if the nerves are stuck, they're getting pulled on too. And so it just really hurts. And that's what feels like it's getting
Yeah.
torn. So those should, this technique should kind of free those nerves up to stretch better. So if it's at least 30% better, that'll usually hold for minimum of 4 hours, but usually a few days,
Yeah.
up to about a week. Then you'll find, okay, it's kind of trickling back a little. So it is a technique we usually have to repeat.
Repeat. Okay.
But,
Does it ever go away?
yeah,
Oh, it does.
Yeah, and then eventually those nerves will kind of relearn to settle down and not be as trapped. When they're irritated, they swell to 4 times their size. So then they get stuck in those tissues. So this helps shrink them down and they'll stop giving off the pain signal. So eventually it can totally stop, but it takes like 6 repetitions usually.
Right. Okay.
How long should that treatment last?
So typically a session of perineural therapy lasts anywhere from 4 hours to a week. So it's quite the range. Commonly a few days of relief, and then it can slowly trickle back. Some people do get a few weeks of relief with just one. So we expect to have to repeat it about 6 times.
All right, Mom, how do you feel?
I feel fabulous. I literally can do a squat and move side to side that I have not been able to do for years. It feels like it's a miracle. I mean, it really is like,
6
it doesn't hurt
seconds.
at all.
6 seconds.
Yeah, I'm
Yeah.
excited to try stairs now.
It's the little things. Would you get this treatment again?
Absolutely.
How did the injections feel?
You cannot even feel the injection
Amazing.
at all. I'm used to needles though.
True. Perineural therapy truly is a miracle treatment. If you have any chronic inflammation, acute inflammation, and you feel like you're not getting the result that you want with your doctor's appointments, your physical therapy, then this is something you definitely should try. I'm so happy that my mom volunteered, or I volunteered her to do this, to show you the versatility of this treatment. So thank you for watching our video today, and please share this with your friends, like, subscribe, all of the things. We will be sharing more videos like this in the future. And if you have any requests on anything you want to see or anything you want us to talk about, we always take suggestions. So just leave a comment and we will see you soon.